Now, I know a lot of parents are concerned about possible side effects of asthma medication, especially with the daily medications. Um,
Right.
what should parents know about side effects?
Really the biggest potential side effect is, and this applies to the inhaled steroids, is there's some evidence that if you're on it for a prolonged time, and I would say at least over a year, that can affect your spinal adult height. Now, generally, with the newer medications we have now, the effect is not significant. It may be that if you're taking the inhaled steroids chronically, then you might lose maybe an inch, inch and a half off of your total height. Now, obviously, nobody wants to be short in this day and age, or ever, I suppose. But at some point, you kind of have to weigh the pros and cons. Am I really going to get hung up on being 5'11" instead of 5'9"? Or do I really want my day-to-day quality of life to be a lot better? There's also another component to asthma that I neglected to mention earlier, and that's allergies. Depending on what you're reading, about 75% of pediatric asthma is allergy related. And if you kind of go down and do some detective work to see if allergens are one of the major contributors to their asthma attacks, you can treat their allergies through antihistamines like Zyrtec or Claritin, that kind of thing. And there's really no significant side effects to that. It's certainly not going to affect your height, and you're treating your asthma more effectively because now you're treating the underlying cause. And then albuterol, the most commonly used medication for asthma, and most parents will know this by now. If you are giving your child frequent treatments of albuterol, you'll notice he'll start running around like a crazy man. I mean, they just get very hyperactive and they're very jittery. So you kind of have to balance out what you're trying to achieve and the timing of the medication or albuterol.
Yes, we have heard about the albuterol and the, the
Yeah,
hyperactivity.
moms love it.
Um, are there things that parents can do on an everyday basis, maybe to manage the asthma and maybe avoid trying to overgive the albuterol?
Yeah, absolutely. You want to, the time that the kids get a lot of albuterol is when they're actually having an attack. So if you can kind of anticipate and you know what your child's triggers are, for example, sports. I will have kids who are well controlled during a certain time of year, and now they're going to say, okay, I'm going to go play football or soccer or run cross country. As long as they go to their doctor a few weeks before and say, okay, I'm going to up my activity level, or I'm going to do these things during the winter season or the spring season where I know my asthma tends to be a little bit worse, at that point the doctor can start or modify whatever medications that person is on, so you're sort of preempting it. You're anticipating that in this situation, my asthma is probably going to get a lot worse, so instead of waiting till it happens, we'll start you on some sort of preventative or modify the dose. But the most important thing really is for parents to recognize under what circumstances are their children having issues and then sharing that information with their provider or their primary care doctor.